Hi, I'm Dr. Chad Larson. We should all know our risk factors for disease, especially the common diseases that really kind of plague our culture today, which is heart disease, diabetes, obesity. I'd say Alzheimer's is definitely climbing on that list. And so these are the things that we're all trying to avoid, and we should really know our risk factor for them. And if you've been listening for a while, you know that we talk a lot about metabolic syndrome, and how metabolic syndrome is a condition in of itself that is a major risk factor for many of these conditions, most of which I just mentioned, like heart disease and stroke and diabetes and obesity, and maybe even some of the neurodegenerative conditions like Alzheimer's. So that's metabolic syndrome. But what is your risk factor for developing metabolic syndrome? If metabolic syndrome is a significant risk factor for these other common diseases, what's your risk factor for metabolic syndrome? So as I treat more and more people with this condition, and I take a deeper and deeper dive into the medical literature, what I'm finding is that we really need to stage where a person is in metabolic syndrome. So there's basically 3 stages, maybe 4 stages, but kind of 3 main stages. Stage 1 is, let's call it stage A, is you don't have any of the criteria for metabolic syndrome, but you have some other things going on that puts you at a little bit more of an increased risk for developing metabolic syndrome. Like, for example, you don't have any of the 5 main criteria. So you don't have high triglycerides, you don't have high glucose, you don't have high blood pressure, your waist circumference is not above 40 for men, and it's not above 35 for women, and your HDL cholesterol is within normal reference range. So you don't have any of those 5 main criteria, but you have, for example, maybe your waist circumference as a male is 38. So, how different of a risk factor is 38 from 40? So it's like, should we do nothing if you have a few things that are close, like maybe your blood pressure is close to being elevated but not quite, or maybe your waist circumference is close but not quite? So if you have a couple of these risk factors, like maybe you're overweight but you're not considered obese, maybe you have family history, maybe your parents, one or more of your parents had metabolic syndrome. These are all things that would land you in stage A, and we have to do something about that. There's some therapeutic considerations that we need to consider in a case like that. I'll come back to that in just a moment. Stage B would be also, you don't have metabolic syndrome. You don't have 3 out of the 5 of the categories, but maybe you have 2. Maybe you have 2 of the categories. Because if you have 2 of the categories, you technically aren't diagnosed with metabolic syndrome, but you certainly have an increased risk for developing metabolic syndrome. So maybe you have, just elevated blood pressure and your triglycerides are elevated, let's say. So you have 2 out of the 5. You don't have metabolic syndrome. But again, we don't want to just ignore that and go, okay, well, you know what, come back when you have full-blown metabolic syndrome, then we'll think of something to do. That's not very creative medicine, not very creative healthcare. So what we want to do is, in medicine and healthcare, basically we think of the more advanced the health condition, the more intense the therapy that needs to match it. So the advancement of the therapy needs to match the advancement of the condition. So, stage A would be one thing, a little bit lighter in the treatment recommendations from stage B. And then stage C is you have metabolic syndrome. You have at least 3 out of the 5 of those criteria. So you might have elevated triglycerides, elevated glucose, high waist circumference above 40 in men, 35 in women. Your HDL cholesterol might be low. So any 3 out of the 5 of the main categories, you're now in stage C, metabolic syndrome, which is the standard definition of having the condition. There's kind of a stage D, which is sort of the most advanced stage, which means that you actually have some end organ failure, like you actually have full-blown heart disease. You have some other kind of metabolic condition that actually comes with a diagnosis. And so that's when that's a more advanced kind of, there's actually tissue destruction happening in an organ system. Like you have you have fatty liver disease that can be evaluated on MRI or ultrasound or blood work. So that's a more advanced situation. Hopefully most people fall into, not hopefully, but it's a little easier to treat when somebody falls in stages A, B, or C. So that's what we're gonna focus a little bit more on. And so, like, for example, from treatment suggestions, I don't want to be too prescriptive because this could vary a bit from person to person. But, you know, like, so if you're in stage A where you don't have metabolic syndrome, but you have some family history, or you also have numbers that are close to being out of range, but not quite, then we might just have to do some things like we want to tighten up your diet. We want to make sure you're not having sugars and sweets and refined processed grain products. We want to get those out of your diet. And we want to make sure that you have at least a 12-to-12 ratio of fasting and feeding. In other words, you're fasting at least 12 hours overnight, and then you have an eating window of about 12 hours. And for a lot of people, that can be all that they need, and maybe working some exercise 3 days a week or so. This could be enough to completely prevent any future progression of metabolic syndrome, and you're kind of good to go. If somebody is in stage B, again, it's a little bit more intense, it's a little bit more involved. So we would think of all the things from stage A plus some extra for stage B. So you got to do all the same stuff that we just talked about for stage A, but now in B, we might have to do things like tighten up the diet even more. We have to specifically go after total carbohydrate value, total carbohydrate consumption per day. We actually might have to squeeze down on that a little bit. We might have to squeeze down a little bit more on your eating window. So instead of a 12-12 like in stage A, you have to maybe have an increase the overnight fast to maybe 13 or 14 hours. So you have an eating window of like of 10 or 11 hours. And then stage C, it has to be a little bit more intense than stage B. So we might push down the carbohydrates even more. We have to maybe decrease the eating window a little bit more, because as we decrease that eating window, then that's going to have a significant effect on insulin. We get insulin down, we get a hormone sensitive lipase up, we start burning fat for fuel, and then we could really work on those 3 out of the 5 categories in that stage C. And then we might have to actually do some extra things, certain other more specific dietary changes to each individual. But you can see each stage is more involved. It's a greater risk factor for really what we're all trying to avoid, which is stage D, where you have a full-blown onset of some type of pathology. And so just want to add a little more current information into metabolic syndrome, this very, very important health condition that not enough people know about. They have no idea what the risk factor is, first of all, for these big diseases like heart disease and diabetes, but even what their risk factor is for developing metabolic syndrome. And so these are some stages to think about, see where you fall into that stage, and then just a couple kind of therapeutic concepts without being too prescriptive about what you may want to start incorporating into your life as you kind of figure out what stage you're in. So keep paying attention to, be very conscious of the food choices you're making and the lifestyle choices that you're making, because your health in the future is dependent upon the decisions that you're making now, in the current moment. Right now, every minute of the day is going to dictate what your health is like in the future. So the more good decisions, healthy decisions that you string together, the more that your health is going to be improved in the future. So hopefully that helps. I will keep reading the studies and bringing you the information. Until next time, keep it real.